Welcome back to Pain Diaries. I'm Dr. Suzanne Manzi in Houston, Texas. I'm going to talk about a new breakthrough medication. If you've been tuning into this show, you know that obesity is a serious global health problem leading to morbidity and mortality. Tirzepatide, also known as Mounjaro, is an exciting new option for those looking to control their type 2 diabetes and lose weight. It's been proven to be an effective and safe treatment option, providing glycemic control, or blood sugar control, and weight loss while minimizing the risk of hypoglycemia. As always, talk to your doctor before starting any new medication regimen. Tirzepatide is a revolutionary new drug that's been developed to help those suffering from type 2 diabetes improve their glycemic control and lose weight. It works by binding to 3 hormones in the body that regulate blood sugar levels, weight, and appetite. Glucagon-like peptide 1, GLP-1, and glucose-dependent insulinotropic polypeptide, GIP, and glucagon. This unique combination of hormones is essential for controlling blood sugar levels and promoting weight loss. Tirzepatide has been proven to be effective for weight loss in clinical trials only. Additionally, those taking Tirzepatide experienced fewer episodes of hypoglycemia and less need for additional diabetes-type medications. So let's look at the study in detail. In a phase 3 double-blinded randomized control trial, 2,539 adults with a BMI of 30 or more, or 27 or more with at least one weight-related complication, excluding diabetes, were assigned to receive once-weekly subcutaneously injected Tirzepatide, either 5, 10, or 15 milligrams, or placebo for 72 weeks. After those 72 weeks, the mean percentage change in weight was 15% for the 5 milligram dose, 19.5% for the 10 milligram dose, and 20.9% for the 15 milligram dose. For the placebo, it was 3.1% reduction in weight. This is a huge amount of weight loss. A reduction in body weight of 5% or more was seen in 85%, 89%, and 91% of participants in the 5 milligram, 10 milligram, and 15 milligram groups, respectively, and 35% in the placebo group. 50% and 57% of participants in the 10 milligram and 15 milligram groups had a reduction in body weight of 20% or more, compared to 3% in the placebo group. Additionally, all doses of Tirzepatide showed improvements in all pre-specified cardiometabolic measures. The most common adverse events with Tirzepatide were gastrointestinal. Most were mild to moderate in severity, usually as nausea or constipation type symptoms. This study demonstrates Tirzepatide is a promising drug for reducing body weight and improving cardiometabolic measures in people with obesity. However, further research is needed to assess the long-term efficacy and safety of Tirzepatide. Tirzepatide is believed to work by targeting several pathways in the body that are involved in the weight regulation. These include reducing appetite. So Tirzepatide has been shown to reduce appetite by slowing down the emptying of the stomach, which can lead to increased feelings of fullness and reduced food intake. It can be found to also increase energy expenditure. Tirzepatide may also increase energy expenditure, which can help burn more calories and aid in weight loss. Regulating blood sugar. Tirzepatide can help to regulate blood sugar levels by increasing insulin secretion and reducing glucose production made by the liver. Reducing body weight. In clinical trials, Tirzepatide has been shown to significantly reduce body weight in individuals who are overweight or obese. So, what are the potential benefits of Tirzepatide for weight loss? Tirzepatide has shown promising results in clinical trials for weight loss. In another study, this one a phase 2 clinical trial, participants who received Tirzepatide lost an average of 11.5% of their body weight compared to 2.4% in the placebo group. In another trial, participants who received tirzepatide lost an average of 14.9% of their body weight, compared to 2.6% in the placebo group. In addition to weight loss, tirzepatide may also have other potential benefits. These include improved blood sugar control. Tirzepatide has been shown to improve blood sugar control in individuals with type 2 diabetes. Lower blood pressure. Tirzepatide may also help lower blood pressure, which is a risk factor for heart disease. Reduced inflammation. Now that's a big one. Tirzepatide may reduce inflammation in the body, which is a risk factor for numerous health issues. Let's talk about some frequently asked questions with regard to tirzepatide. So who is a candidate for tirzepatide weight loss treatment? Currently, tirzepatide is currently being studied in clinical trials for individuals who are overweight or obese. Unfortunately, it's not yet available for general use. What are the actual side effects of tirzepatide? While tirzepatide has shown remarkable weight loss results, it is important to note that it may cause some side effects. The most common side effects reported in these clinical trials were gastrointestinal in nature, including nausea, vomiting, diarrhea, and constipation. However, these side effects were generally mild to moderate in severity and resolved over time. In addition, the risk of hypoglycemia or low blood sugar levels was slightly higher in the tirzepatide group compared to that placebo group. It is important to note that tirzepatide is not recommended for people with a personal or family history of medullary thyroid carcinoma or multiple endocrine neoplasia syndrome type 2. These are definitely no-nos when prescribing tirzepatide. How long does tirzepatide treatment last? Well, the length of tirzepatide treatment may vary depending on the individual needs and response to the drug. Clinical trials have ranged from 26 to 72 weeks of treatment. Is tirzepatide safe for everyone to use? Well, tirzepatide is currently being studied in clinical trials and is not yet available for general use. As with any medication, it's important to consult with a healthcare provider to determine if tirzepatide is a safe and appropriate option for an individual's specific health needs and condition. Hopefully, this medication will be available very soon, so please consult with your doctor to see if and when it's available, if you qualify. In conclusion, tirzepatide is a promising new drug that has shown potential for helping individuals lose weight. It works by mimicking the actions of naturally produced hormones in the body to regulate appetite, increase feelings of fullness, and regulate blood sugar levels. Tirzepatide has shown promising results in clinical trials for weight loss and may also have other potential benefits, such as improving blood sugar control, lowering blood pressure, and reducing inflammation. As with any medication, it's so important to consult with a healthcare provider to determine if tirzepatide is a safe and appropriate option for an individual's specific health needs and conditions. I'd like to welcome special thank you to our guests on today's episode of Pain Diaries. What a great episode discussing obesity medicine and board certification, reactivate, and imaging findings with our special guests. We had Dr. Patel from Southern Spine and Dr. Wynn in Oklahoma. I'm Dr. Suzanne Manzi, physician owner of Performance Pain and Sports Medicine. Remember, you can find me in Houston at 4126 Southwest Freeway, Suite 1700 in the T-Mobile Tower on the feeder of Highway 59 in Houston, Texas, or in Main Street in League City. Subscribe on YouTube to Pain Diaries Dr. Manzi to catch all my episodes and shorts, bringing you all things pain-related and educational information on the newest and best technologies out there to make your life better. Remember, this is Pain Diaries. Take care of you so you can take care of business. See you next time.
This has been a Now Media television feature presentation. All rights reserved. Broadcasting live from Houston, from the space city to the world. You are watching Now Media Television.
Hi, this is Pain Diaries. Welcome to today's show, where we talk about taking care of you so you can take care of business. I'm Dr. Suzanne Manzi, the co-owner of Performance Pain and Sports Medicine. Pain Diaries allows me to educate about the treatment options for healing painful conditions. I'm a pain doctor and love educating about what can be done to help with chronic and acute pain, as well as wellness, so you can live your best life. I love to showcase the options and technologies available to those who are suffering. You or your loved ones do not have to suffer. There's treatment options for everyone, whether you're stuck with having difficulty losing weight, having pain somewhere in your body, or even having issues choosing your insurance. On today's show, I'm going to showcase a few different treatment options that I discuss with patients in my office. I'm also going to feature the Chief Medical Officer of Abbott's Neuromodulation Division and one of my physical therapy colleagues, as well as another pain doc that has had great success with treating low back pain with Reactivate. You can find my partner and me online at www.performancepain.com. We don't just treat the pain, we make a difference in how you live. Make sure you find us online and subscribe to my YouTube channel at Pain Diaries Dr. Manzi. And make sure you share the show with those you love. Hello, I'm Dr. Suzanne Manzi, and this is Pain Diaries.